Thank you all for joining us at our peer connections today on daily skin checks and pressure injuries. So I would like to begin by acknowledging that we live and work on the traditional territories of many Indigenous nations across Turtle Island. We must recognize the importance of the land and our treaty agreements. We acknowledge the ancestral and unceded territories of all Inuit, Métis, and First Nations peoples. As our Spinal Cord Injury Ontario community encompasses many geographies, we ask that everyone take a few moments of their day to find out which unceded or treated territories you may live and work on. You can use the link www.native-land.ca to learn more, and that will be put in the chat box. So my name is Julie. I am a peer program coordinator for Spinal Cord Injury Ontario in the London region. And I'd like to thank my colleague who is with us today. Her name's Jaspreet, and she's doing all the behind the scenes help. Jaspreet is also a peer program coordinator in the Toronto region. We are recording this session, so if you do not wish to be seen, please ensure that your video is turned off. We'll also be keeping everyone on mute throughout the presentation, just to cut down on some of the background noise. You can ask questions throughout the presentation. Use either the raise hand function or the chat feature. So we will be monitoring both throughout. Today, like I said, we are here to learn more about preventing pressure sores. So in this Peer Connections, we have Jennifer Duley, who is with us, and hopefully she will give us some insight on how to do that through daily skin checks. So Jennifer, I will let you introduce yourself and take it from here.
Thank you so much, Julie, and thanks for having me. So my name's Jennifer Duley, and I'm actually a physiotherapist, and I've been working in Hamilton in spine. Most of my time has spent on our Acute Spine Unit here for almost 20 years now. In the last probably 5 years, I've taken some time away from the acute care ward, and I've been working with the rehab team, the spine rehab team, and working in a capacity with the SCI Consortium. I'm not sure if you guys are familiar with that consortium, but I'll talk a little bit about it in my presentation, and working to introduce best practice care in our spine rehab, which is happening sort of all over the country now. And so I'm here today to talk about pressure injuries and skin checks, and doing a daily head-to-toe skin check is what we would say is best practice for prevention of pressure injuries. So I'm just going to share my screen. Julie, can you see that? Because I can't see you guys now.
Yeah, we can see it.
Perfect. We're going to chat about daily skin checks and preventing pressure injuries today. I'm going to talk about some of the work that we've done here in Hamilton, but also in working with the SCI Consortium and Cortree. Quick definition of what a pressure injury is. So that a pressure injury is skin and tissue damage. It can be caused by sitting or lying too long on one part of your body, but it can also be caused by pressure combined with shear. And so shear is when your skin's moving one way and then the tissues underneath is moving the other way. And often we see shear in things like if you're sliding down in your bed, that can cause shear, or transferring. If you're doing a slide board transfer and you don't lift your bum well enough, then you can cause shear that way. The deeper the pressure injury is, the harder it is to treat. So why prevention is so important. In individuals with SCI, pressure injury prevalence is really high. So the literature out there shows us that 85 to 95% of individuals with a spinal cord injury will have a pressure injury at some point in their lifetime. Pressure injuries can occur at any time following a spinal cord injury, and 20 to 33% of individuals will develop a pressure injury before admission to inpatient rehab. So this is in the time when they're in acute care right after their injury or surgery. And 10 to 48% of individuals with a spinal cord injury will develop a pressure injury during their inpatient spinal cord injury rehabilitation. Pressure injuries can have life-altering consequences, resulting in reduced quality of life and increased morbidity and mortality. Common sites of pressure injury. So this is a diagram put out by Spinal Cord Injury Ontario in 2015, and we actually use this at our bedsides now for education with our patients, sort of just showing the common areas of where we find pressure injuries, and really there are any bony prominence that you may have on your body. So your ankle bones, your sit bones, your hips, your elbows, your shoulder blades can be at high risk. As I mentioned before, I've been the last 5 years involved with the SCI Consortium. So it's a implementation, evaluation, and quality care consortium. So this is actually now a national consortium that is right across Canada. And the goal of the consortium is to achieve optimal and equitable healthcare services to ensure functional recovery, health, and well-being for people living with spinal cord injury. And the way that they're trying to achieve this goal is by implementing best practice in spinal cord injury care in our rehabilitation settings. So the consortium looks at different aspects of care, and then they have asked all of the spinal cord rehabs to implement best practice around these care domains. So in the domain of tissue integrity, which just means our skin, their goal is to reduce the overall incidence and severity of pressure injuries among individuals with spinal cord injury or disease throughout their lifetime. We're doing this is by promoting and establishing patient self-awareness regarding daily skin checks prior to rehabilitation discharge. So this has been a big change really across the country, that rehab facilities are now considering skin checks as a rehab goal. So just like you may have had a goal to learn how to independently cath yourself, we are now teaching patients and care partners to either complete skin checks independently if they can with a handheld device like a mirror or a cell phone on a selfie stick, or that they are able to self-direct their care partners to do proper skin checks. With the consortium group, there's someone like me in each facility across Canada, and we meet to work towards implementing with the different teams. And one thing that we found when we started looking at education around daily skin checks is there wasn't terribly that much out there for us to be able to give to patients on how to complete a head to toe skin check. So this is where we worked with Spinal Cord Injury Ontario and Coretree, and we developed this education video. So if you're familiar with Coretree's education website, you can log on there. They have lots of different education videos, but we created this one specific for how to complete skin checks and what you're looking for. And I will say Julie is famous in this one for us. So I'm going to play it for you guys, and then we'll move on after.
My 15 minutes of fame.
One of the most common medical complications following a spinal cord injury are pressure injuries. Since prevention is much easier than treatment, having a routine skin check is the key to detection and early intervention. While lying down on our back, areas most vulnerable to a pressure injury include the back of the head, the shoulders, tailbone, and heels. While lying on our side, areas to look out for are ears, the back, elbows, hip bones, between the knees, and the ankles. While sitting in our wheelchair, the elbows, the tailbone and sit bones, back of the knee and shin, and the feet are most likely to get a pressure injury. Based on your own functional abilities, you can complete skin checks either on your own or with some help. Here are Nancy and Julie to take us through their own skin check routines.
Hi, I'm Nancy. I do skin checks myself.
Hi, I'm Julie, and I have help doing my skin checks.
Having routine skin checks at home are very important. Let me demonstrate some of the ways to do it yourself. I usually check my skin twice a day as part of my routine. Some of the things I look for are changes in skin temperature, whether it's warmer or cooler. Swelling, the skin is firmer or softer than the skin around it. Changes in my skin color, and any blistering, tearing, or scabbing. Or if any of these areas are too difficult to see with a mirror, you might find it easier to use a selfie stick and take pictures or videos of these areas with your cell phone.
Alternatively, if you're not able to use a selfie stick, You can ask someone to take pictures of each of these areas with your cell phone. This can be done from a wheelchair or the bed. This will allow you to clearly see the condition of your skin and watch for any changes in appearance over time. Of course, in real life, skin checks are done looking directly at your skin. Again, you're looking for any signs of skin injury or signs of what might be the beginning of a pressure injury. Remember, pressure injuries can go from small problems to big ones quickly. So prevention, through frequent and thorough skin checks, is the key to catching and addressing them before they cause more serious health problems. Keep in mind, some of the more common causes of pressure injury can include changes in equipment, changes in routine, or lack of movement.
For more information about pressure injuries and preventing them, check out the resources listed in the video description.
We felt so fortunate to be able to work with Cortree to develop that video because there really wasn't much out there, especially showing how to check with the mirror and the phone. And now all the sites are able to use this video for education, not just with our patients, but also with our staff. And then it's available for in the community as well. So, there we go. So I'm just going to go through and sort of talk a little bit about the work that we did in Hamilton around skin. And we obviously were incorporating some of the work that the consortium was hoping that we would do. And so part of the consortium is they collect a lot of data from us to really, so we can have indicators to look at if what we're implementing actually working and are we seeing a change in things. So in 2020, we started submitting data to the SCI Consortium around pressure injury. So pressure injury prevalence just means if we look at the ward today, or sorry, if we look at in 2020, how many patients that did we have that had pressure injuries? And then the incidence is of those pressure injuries on our rehab unit. Because obviously we have patients that come to us that already had developed a pressure injury, probably like in the acute care stay before they came in. And so in 2020, our numbers were fairly low, looking at our prevalence of 12% and our incidence of 15%. But then we found through 2021 and 2022, we had a huge increase in pressure injuries. So that was the number of patients that had them, but then we also looked at the total number of pressure injuries, because often patients don't just have one, they may have a coccyx and a heel at the same time. And again, here we saw big changes in our numbers throughout these couple of years. We wanted to create a process to address pressure injury prevention and management on our unit, on our rehab unit. So first we wanted to look at why did we think that we had this huge increase in pressure injuries. COVID played a huge part in an increase of pressure injuries. In 2020, our unit was actually shut down and all of our rehab patients were relocated to other units. So then these patients were on units with a team that didn't have SCI expertise. Staffing challenges for sure led to this increase in pressure injury. So our nursing and allied health staff were redeployed to acute care units. We had throughout that COVID time, a huge retirement of experienced nursing staff replaced with junior staff that didn't have the same expertise. We had large staff shortages, which we still are dealing with today, resulting in practice variation. So, and especially if you don't have the staff to turn patients or to actually do head-to-toe skin checks, then it's just not happening. We actually have a skin and wound healing team, but because of the staff shortages, they usually round once a week, and this wasn't happening consistently. There was decreased availability of in-person education opportunities for our staff, and a lot of the education in the hospital was now focused on COVID. All of our patient education classes were canceled because we couldn't meet and gather together. In our documentation system, there's not good places for us to be able to document patient education practices and our pressure injury assessment and management. And so our target state was to reduce the overall incidence and severity of pressure injuries with individuals with spinal cord injury or disease during their rehab stay. We wanted to promote and establish patient self-awareness regarding daily skin checks prior to discharge, and we wanted to standardize our documentation practices on our unit. So our hypothesis is that carrying out a comprehensive staff and patient education program on pressure injury prevention and management on a spinal cord injury rehab unit would be effective in reducing our incidence and prevalence of pressure injuries, increasing the percentage of head-to-toe skin checks that were being performed daily, and increase our patients' confidence in independently performing or directing daily skin checks. So then we developed an action plan. We call this our process standard work. So standard work is really just a step-by-step sort of algorithm of what we're going to do and put in place to bring about our target state. So our standard work included processes around identifying tissue integrity issues, how to assess pressure injuries, specific accountabilities for different disciplines on our team, applying appropriate interventions for our identified issues, and then documentation. This is what our process map looks like. So it goes through what happens when a patient's admitted. So on the left-hand side of the screen really speaks to the nurses doing a comprehensive skin assessment with our patients. If no skin issues are identified, then that skin check is carried out twice a day. If skin issues are identified, then the skin check is still carried out twice a day, but then it goes into treatment. Do we need to have our wound team come in and assess the wound and help us with that? But also the big thing on this side was really communication amongst the team around the wound, and that somebody had skin issues so that the whole team was on board to ensure good healing of the wound, but also good prevention so we weren't getting more wounds. The right side of the algorithm really speaks to the education. So the OTs on the unit now took this on as the head-to-toe skin checks as part of their rehab goal that they are teaching patients before they leave. So the OT would determine whether they thought somebody would be able to complete an independent skin check or not. If they were able to complete an independent skin check with a mirror or a device like a phone, then that would be a rehab goal that the OTs and the OTAs would work on with the patient. If it was felt that they would not be able to complete independently, but they would self-direct, then this was something that the nursing team would take on to educate the patient and the patient's care partners as well on how to do proper skin checks. We were able to start up our education sessions again, and so now have a skin health education class, which we were able to incorporate the video that I just showed you into that class. Staff education, this looked like all of our team, allied health and nursing, attended e-learning course on, this is a corporate course that we have on wound and skin management. And some of the staff also went to an in-person 2-day workshop on skin and wound management so that they could be leaders on the ward and a resource for the rest of the team. We had a mandatory in-service on that standard work I just showed you, which included the video. So I actually took on that education with the team to make sure that everyone was aware of what their role was around skin, and then showcase the video that we created with SCIO. Patient education was a huge thing for this as well. So our patient education classes started back up. And like I said, we include that video, also doing bedside education by the team. And some of our education resources we actually updated. So we used to have our own skin education Hamilton Health Sciences brochure, and we got rid of that and we started using core trees. And at the end of the video, it showcased that pamphlet. If you guys have a chance to look at it, it's so well done with great pictures, such a good education resource. So now that's what we're providing to our patients and their families. And then we looked at specific indicators to see if all the work that we've done and the education for staff and for patients hasn't made a difference to certain things that we were looking at, like pressure injuries. So some of the things we looked at is the proportion of individuals who completed a daily head-to-toe skin check. We looked at patients' awareness of skin integrity prevention and management, looked at proportion of staff attending education, proportion of individuals diagnosed with a pressure injury, so both that prevalence and and incidence. And we also looked at the severity and status of our pressure injuries at discharge. We started our initial implementation of this new standard work in June of 2023. And so preparing the team with education throughout June. We had daily communication with the team reinforcing our new practices and gathering feedback from the team on the new practices. So making any changes that we needed to make it flow better. And this is kind of a crazy slide, but what it shows here, so we started tracking, so looking at specific daily head to toe skin checks. So now we were asking the team to complete with patients every shift. So Q shift meant that it was being done twice a day. Best practice for skin checks is that a skin check is done before somebody gets out of bed and into their wheelchair. And then a skin check should be also done once somebody gets out of their wheelchair and back into bed. Looking at this, you can see a lot of reds on the left-hand side. So this was when we first started the practice, and I was looking at each shift, so morning and evening, was there documentation from the nurses that the head-to-toe skin check was done? And they would also document who it was done by. So if it was just done by them, it would say staff, but as we started to educate our patients, and then it might say staff and patient because they were doing it together. And then as time went on in their rehab stay, it should say that if the patient was able to do it by themselves, that we've transitioned that skill over to them. And so in the beginning of our practice, we had a lot of red. So there was really not that much documentation that these head to toe skin checks were being done. But then as we moved on into July and August, then we saw a lot more green there. And knowing that we were implementing and that patients were having head to toe skin checks and education around it on a daily basis. Some of the data and what it looked like. So these head to toe skin checks. So this July to December 2022 and January to May 2023, when I looked in the chart, I would see 50% of the time and 42% of the time in that time period that we would see documentation on daily head to toe skin checks. But as of patients that were admitted in June and discharged by December, we had increased up to 86% of the time that we were seeing documentation around these head to toe skin checks being done. So we felt that was a real big win for us. Another thing that we did is we met with patients before they were discharged home and had a patient survey and just asked them. So were they one of the education pieces we had with the staff is a lot of time we're checking patients' skin, but we're not verbalizing to them what they're doing. So they're not even aware that it's happening. So we asked patients, were they aware when staff members were checking their skin? And so 57% of the time, patients reported that they were. So not bad, but definitely some work to go on that. We asked them, did they know what to do if they developed a pressure injury? And here, only 50% of patients felt confident that they knew. And what we found when we dig more deeper into it, it was usually the patients that had pressure injuries knew what to do if they developed one, but we were sort of missing that education with the patients who didn't have any skin issues. So it was good feedback for us to make sure that we're including education to everybody, whether they had issues with their skin or not. This was a big one for us, is how confident did our patients feel on completing their skin checks or directing skin checks, and 72% actually felt very confident and 21% somewhat confident. So we felt this was a real win for us, that definitely patients were taking on the skill and understanding what we were teaching and able to do it themselves. As far as education, so 93% of the unit staff completed the online e-learning modules and then had the in-service with me on the standard work. And almost 30% of our staff was able to attend the in-person skin workshop. What happened with our pressure injuries after this time? So our prevalence is still quite high. So 2023, if we look here, we're still at 26%. The hard part about prevalence when you're looking at it is you don't have as much control over the prevalence, because if patients come into the unit with wounds, that's sort of out of our control. But what we can control is the amount of patients that develop wounds when they're with us. In 2023, we had quite a decrease and back down to sort of more levels that we were seeing prior to the pandemic and going into isolation. And again, same with total number of pressure injuries. So we're seeing a downward trend now of the amount and the number of pressure injuries that are on our unit. So our target state, reduce the prevalence and incidence of pressure injuries on our unit. We felt that we were able to do that. We were able to promote and establish patient self-awareness regarding skin checks. We had less pressure injuries, but also the severity of the injury. So even when we found someone that had a pressure injury on our unit, it was usually found when it was a stage 1 or it was just a reddened area versus a deep wound. So that's a real win because it's easier to reverse that when you're at a stage 1 or just redness versus a real deep wound. So next steps for us is to continue to get patient feedback and revise practices. We want to enhance and sustain our OT practice of teaching patients to use handheld device for skin checks, continue to monitor nursing, our allied health practices, and revise our standard work. So we have good flow with it, and include education on our standard work and our orientation for all new staff. Implementation takes time and practice. It was over a year ago that it was completed, but it took a long time because the work involved so many different people on the team. Sustainability of the practice is that we learned we have to keep closely observing. So that red and green that I showed you, every so few months, we want to go in and re-look. And if we're slipping in our numbers of our head to toe skin checks, then we need to feed that back to the team to ensure that we get those numbers back to optimal levels. Patient input is imperative through all stages of implementation. Even if the team thought they might have provided the education, if the patient didn't receive it or take it in, then we need to do better at that. So it was really good practice to be able to ask patients before they left how they felt, and if they didn't feel confident or they felt they needed more education around it, then we were able to have the staff come back and provide more education around skin. And then importance of documentation. So we're quite lucky in Hamilton. We have a new documentation system where we're actually able to take pictures now of our wounds. And so we can really follow them along and take pictures of skin. So sort of like the practice we're asking patients to do at home. It's always good if you have the ability to take pictures and then you can follow along. That's it. Thank you. If there's any questions.
Thanks, Jennifer. I don't see any in the chat box, but if anyone wants to raise their hand or just unmute themselves and ask Jennifer a question, feel free.
I'd be interested to know from you guys, was being taught how to do skin checks something when you went through rehab or when you were hospitalized, something that was done?
Never.
Never.
No.
And Phil, how long ago were you in rehab?
I wasn't in traditional rehab because after my injury, I had 4 spinal surgeries. So it was kind of like about a year and a half. So it was like, spend a long time in hospital, go home for a bit, come back in. So it was never like a traditional rehab. I'm going for spinal surgery in about 3 weeks at Hamilton General. And yeah. Jennifer, did we meet at the...
We did, yeah.
I thought that was you. Yeah, sorry. I just didn't want to blurt it out and say, I'm sure we've met. It's like I'll be in Hamilton the 9th of July. I'm having spinal surgery. I'm having fused from C1, I think, down to T3 or 4. So, yeah. So it'll be my 6th spinal surgery.
So I will encourage you when you come in here that you advocate for your skin to be checked.
I will. Absolutely.
I'm sure that you will, right?
Yeah, because my last neck surgery years ago at Hamilton General, I got the worst pressure sore I'd ever had.
It's not just for patients with new spinal cord injuries, it's for everybody, right? And especially as we have to come back into the system, even more important. And unfortunately, we have to self-advocate, and especially if you don't end up on a specialized spine unit. then there's even less expertise. So even more importance that, we want people with spinal cord injury to have the knowledge about skin, feel comfortable to be able to ask and direct that care wherever they are, at home, if they're back in the hospital, because it's so important.
The mattress, the air mattress, are you able to request one of those for that reason, because of pressure sores, the susceptibility?
I would say you should always ask what the
Okay.
hospitals have, depending wherever you are. In our hospital, I don't know what other facilities do. We don't always put people right on air. We have a mattress called an Isoflex mattress, but it is a pressure relieving mattress. So it's really to ask, am I on a pressure relieving mattress? Because when we're just put on regular mattresses, that puts us at higher risk. On the unit I work on, because we are specialized spinal cord injured therapists, we ensure that we have a pressure relieving mattress on every one of our beds, but if you're admitted to a different unit, that's not generally the case. So for sure, advocacy, which was one of the big reasons we wanted to make this video with SCIO and like you said, Phil, I don't think that head to toe skin checks was really at a rehab goal. It was never thought of as a rehab goal. And so that's sort of what we're trying to change the staff's mindset here, that this is a goal that we need to teach people, so that they can continue doing it when they get to the community. Because a lot of times we provide care and we're not vocalizing what we're doing. So people have no idea that we've actually been checking your skin every day. So we really want to transfer that knowledge and that skill for when people leave the hospital.
Yeah, I even talked to my surgeon and I said, if there's any complications like last time, I says, please, please, please do not send me to Brantford General to convalesce. Last time I was promised in Hamilton that I would go up to Brantford for a while to convalesce and then be sent back to the regional rehab. Never happened. I get to Brantford. They said, oh, you're not going back. And I'm arguing with them and saying, yes, I am. I got no rehab in Brantford at all. And they came to me and said, oh, we want you to come back as an outpatient 4 or 5 days a week. I said, not happening. Yeah. I said, did nothing for me here. And I said, I'm not coming back. And because I lost the use of my hands and my arms after the surgery for about 4 or 5 days. Mm-hmm. And so it took about a year, but I had a physiotherapist that came to the home and I lucked out. She really helped. But yeah, there's these things that you don't know going in to ask for. And that's why I'm just thought I might as well ask while I'm here. It's
Sure, for sure.
Oh, Ron, you have a question? Yes, go ahead.
6 years ago, I was at Lyndhurst for 11 weeks. And they asked me if I wanted to partake in a skin care study. So I said, sure. I thought that was a good move. And so every day, I think I only was seen once a day. And they didn't give me much in the way of education. I just noticed what they were doing. Mm-hmm. And it would be pretty quick. And then that was it. Mm-hmm. And then they sent me a letter of appreciation at the end. That's what I got. So in the 6 years since then, I haven't actually done a formal self-examination, but I mean, I do pay attention to my body. So if I notice things like my legs feel very heavy when I sleep, for example. So I always check the insides of my knees to see how they're doing. Mm-hmm. But I learned from this video that sometimes injuries help or take place below the skin. And that I didn't know that. And that's very significant.
Yeah. Yeah, you always want to check sort of head to toe, right? And especially those specific areas, those bony areas is where they often happen.
I do have multiple PSWs that are coming in to help me. I do use my cell phone a lot, but I also ask a lot of questions. So like if, let's say I have cell marks on the back of my legs or something, they'll say, oh, you've got red cell marks. And I'll say, oh, are they red or are they pink? Do they blanch? Do they not blanch? Right? Just to get a better indication of, is it worrisome or just something that's probably going to be gone by the morning? So I just find the more questions I ask, the the better it is for me. And with my cell phone, sometimes they'll take a picture and say, oh, it actually looks a lot worse on the cell phone than it does in real life. So again, I find asking more questions.
For sure. That's great for you to know what your skin is like. And so you can ask questions, especially too, because if you have different PSWs that come, they might not be familiar, right? So wanting to just make sure that you have a good understanding of what your skin looks like and what's normal and not normal for you, for sure.
So we do have a question in the chat box. Jen, did this practice change cost anything for the hospital? And was there any resistance to the change?
The cost, not much, actually, because Tori knows this, that we had kindly, SCIO had donated all of the brochures for us to give out to patients so that we didn't have a cost for that. And then, of course, pairing with SCIO for the video, and that's online and free. Probably the cost is the mirrors, because we did purchase mirrors so that patients could practice with them. I mean, we would love to be able to have mirrors to just give to patients when they leave, but that has not happened here. And I know different facilities have different budgets. So for instance, in London, they actually have a maintenance department that makes a long-handled mirror for them that they're able to give to patients to take home. So sort of depends. We have ones that you can practice with, and we would give you information if you wanted to purchase on where to do that. We purchased a few selfie sticks and some adaptive handles, but some of the mirrors we just got, because you can see in the video, like that was a dollar store mirror that she used. So you can, it doesn't have to be fancy at all. Not more nursing staff, but education. And again, it wasn't education to our staff on how to do a skin check, because that's basic nursing. They know that, they've learned that. But the education more came in how to educate somebody to do it. And then even really a lot of our education was verbalizing to people what you're doing, because again, as caregivers, we're constantly providing care, we're multitasking all the time. And so when I would ask patients, were you aware that the team was checking your skin? People would say no. But even though every day it was being checked, right? Because we're helping in the shower, we're helping with incontinence care, the nurses are looking at the skin. So that was a big part of it, is really trying to get staff on board with just verbalize what you're doing and let patients know what you're doing, because that's education as well.
Phil's got his hand up.
Yeah, I was just wondering, where can you get a mirror like that that's got an extra handle? I've never seen anything like that. That would be perfect.
Yeah, like Shoppers Home Health, those types of facilities, you can get them there. There's telescoping mirrors.
Oh, okay.
So it's kind of like a selfie stick that pulls out and they have a mirror on them.
Okay, fantastic.
So yeah, some people use those. Some people really like, because we're in the tech world of phones, you just get like a selfie stick from the dollar store and throw your phone on it, and you can check that way.
Dude, yeah, that's pretty slick too. That would be good.
Yeah, yeah. So it doesn't have to be expensive. We use a lot of dollar store stuff here.
That's great.
Yeah, it is.
Thank you.
Does anyone else have any questions? Nothing in the chat box. And just feel free to unmute yourself if you'd like to ask the question.
I just found some on Amazon.
Perfect.
Oh,
there you go. Amazon always has everything.
It's convenient because it comes right to the door.
Tori, I have another question. Now that you've had this rolling for a year or so, have there been other skin check strategies that you have heard people talking about that Julie and Nancy didn't capture in their demo videos that we might want to think about for the future?
Not that I know of, but that's worth asking around about.
Yeah.
I feel like Nancy and Julie are the experts. Most of our patients have new injuries, right? So they're just learning from us. They don't really know techniques. There's lots of things that when you get home and you do different things, and this works for me and that works for me. So we don't often hear that, but that would be great. Another reason to follow up with people with lived experience to find out, is there other methods that people use that would be helpful, for sure.
Okay, I don't see any other hands up or chat questions. So thank you so much, Jennifer. I appreciate this information. Pressure sores are definitely a huge issue, as we all know, in the disability community. So it's always good to get more information. So thank you very much for taking the time and
Thanks for having
presenting for us. And thank you all for coming. So I invite you all to always check out our Core Tree page, our website, for all the upcoming, any new videos that peer connections or events that are happening within your region. And other than that, I hope you all stay cool and have a nice rest of your day.
My surgery's the 9th of July, so if you have a chance to pop in for a visit,
I'll keep an eye out for you.
for 5 days. Yeah, thanks very much. Good
I'll
seeing
make
you.
sure they're checking your skin, Phil.
Yeah, right on. That's good. That's good. No pressure sores this time. That'd be great. I'm so worried about, yeah.
Thanks,
That's great.
everyone.
Thank you.
Take
Great
care.
seeing you.